Hello, all. Here we talk about a culmination of much of the things that we're learning in this course. And this chapter is called Diet and Health. Um, Maybe better title would be Lifestyle and Health or Eating Pattern and Health. Um, but that's chapter 18, and we'll hit some of the highlights here, things that you should be thinking about, and things that we've learned through through the course. Um, we start off talking about nutrition and infectious disease, certainly a topic that's been highlighted with us in the last several years. Advancements in medical science has increased our life expectancy with immunizations and antibiotics and knowledge out into the public. And a strong immune system depends on adequate nutrition. Poor nutrition weakens the immune system. And if we were to think about what that, where that comes from, we could think about a few things here. The body's first line of defense is coming from our skin, our mucous membranes, our GI tract, all these keeping healthy. And we could think about the nutrition that supports health of these organs. If these fail, cells and organs of the immune system kick in. Foreign bodies that elicit immune responses are called antigens. The two types of white blood cells that defend against infectious disease are the phagocytes and the lymphocytes. Now, if we take a look at these little matching here, lymphocytes, these are T cells, and they recognize antigens that are uh, produce cytokines and an array of communication to destroy particles with foreign antigens not recognized. These are highly specific and they have memory. And they participate in rejection of transplanted tissues as well. The phagocytes, first to arrive, if a foreign invader gains entry, and they engulf and digest via phagocytosis. And they also include neutrophils and macrophages. The lymphocytes, these are B cells, and these respond to infection by dividing rapidly. They produce antibodies, a class of proteins called immunoglobulins, and they also have memory. The nutrition and immunity depends on nutritional status, not overnutrition, not undernutrition. The immune system responds and requires greater nutrients to keep healthy. Synthesis, then what happens is synthesis of antibiotics, cytokines, and cell multiplication. Infectious disease raises nutrient need and decreases, however, decreases food intake. It's a synergistic downward spiral. The nutrients important, very important, even more important in an immune compromised situation is protein, quality protein to maintain those organs that we've mentioned right here. Omega-3 fatty acids, these are the essential fatty acids, and vitamin A for the reasons that you see in this table from the book. Vitamin D, we know that this is involved and regulates immune responses and participates in antibody production. vitamin C, vitamin A. These are antioxidants. B6, participating in well, protein synthesis along with vitamin B12 and folate. Selenium also is an antioxidant and also zinc. So immune system is also interfaces with inflammation, how we understand inflammation and chronic disease. The immune system responds to infection and or injury by several avenues, including blood supply to the site, increases blood vessels become permeable, phagocytes engulf microbes, kill them via oxidative molecules, and fight off infection that promotes recovery. Chronic inflammation lends itself to further chronic conditions, including obesity and other chronic conditions. Many of the 10 leading causes of death, and we started the course with this, reflected in chronic diseases, develop response to risk factors. And 5 of these risk factors include lifestyle, our eating pattern, physical inactivity, being overweight or obese, alcohol, or drug use. Each of the chronic diseases develop in response to many risk factors, and genetics and lifestyle often work synergistically. For example, cigarette smoking increases heart disease and those predisposed to develop it. And we've seen this figure early on in the course. 10 of the leading causes of death, among them 4 of them known to be diet related. And in this table, we see dietary risks and the chronic diseases associated with these risks. So some of these risks we can modify, some we cannot. For instance, shown in here, age we can't modify, and genetics also, for the most part, we cannot modify. Most of the factors here we can modify with behaviors or lifestyle. This at one time was called, which no longer is, metabolic syndrome. Now we just speak about the individual conditions, but in this figure, you can see a central importance of weight management and obesity interconnected with many of these well-known and still being studied intensely chronic conditions: diabetes, atherosclerosis, hypertension, stroke, heart attack, and cancer. Cardiovascular disease collectively are diseases of the heart and blood vessels. Coronary heart disease, sometimes just abbreviated by its acronym, CHD, is the most common form of cardiovascular disease. It's usually caused by atherosclerosis. This is an accumulation of lipids and other materials in the arteries. The disease consists of large streaks that engulf, fill with cholesterol and calcium, and become encased in fibrous tissues. This is known as plaques that stiffen and narrow the arteries. This disease is a complex inflammatory response to the tissue damage. Inflammation, such an important response and trigger for many conditions, still not completely understand, but let's do this little matching exercise here. Inflammation. Oh, this is a matching exercise left for you to stop the recording here and uh, match these among that we just spoke about in the last slide. So what about the risks of coronary heart disease? Um, some of these are modifiable with lifestyle or intervention, and some are non-modifiable. We might think of genetically predisposition. Half of the U.S. Adults have at least a minor risk factor by the age of 20. Regular screening and early detection um, is has been important in diagnosing and enabling intervention and actions. The non-modifiable risks, as we mentioned, would be age, gender, and family history. The risks of CHD, the modifiable ones, include um, high blood pressure, high low density lipoprotein, low blood, high density lipoprotein, cholesterol. We should think back on when we review this. Diabetes, obesity, physical inactivity, smoking, and anthropogenic, anthogenic diet that is high in saturated fats, low in vegetables and whole grains. His desirable ranges or numbers that would avoid these CHD risks. Among the non-modifiable risks, age, um, gender, men have earlier onset set of risks. Early CHD in immediate family members that have had related diseases, and people with high genetic risks. Now we mentioned here low density and low high density lipoprotein cholesterol. It's strong correlations with also with total cholesterol, strong correlation, total high cholesterol, strongly correlated with atherosclerosis, LDL, the most atherogenic lipoprotein that is predisposing or initiating atherosclerosis, that is plaque formation and inflammation process. Adequate high density lipoproteins LDL is beneficial. As we've seen earlier, these serve as to scavenge excess cholesterol. It might be in the bloodstream, and return it to where it may be needed, or back to the liver. Also, high blood triglycerides promote atherosclerosis. Chronic hypertension, high blood pressure. These also a risk for heart disease, injuring artery walls, accelerating plaque formation, and diabetes. Other risk factors, obesity, physical inactivity, mentioned. These also just drive these risks in the wrong direction. So the benefits of weight loss and improving fitness are clear. Cigarette smoking introduces potential initiators of chronic disease. Atherogenic diet, what are these? This elevates LDL cholesterol, and this cluster of risks might used to be, no longer. This is an outdated term. Metabolic syndrome. It's now metabolic cardiovascular conditions. There's certain markers of inflammation that could be monitored. Early treatment and focus on lifestyle changes would be important interventions. And here are some of the strategies to reduce the risk of CHD. Important dietary patterns or eating patterns that we've spoken about. Energy balance helps in weight management, and fats, saturated fat, keeping them below the recommended 10% of total calories, and avoiding as much as possible any foods that might contain trans fat, which are unnatural forms of fatty acids that are formed in certain processing of foods. Other risks, ways to manage risk, is to reduce sodium intake to below the maximum 2,300 milligrams per day. Here's the suggestion to intake even lower than that, to 15 milligrams per day. And a way to study this or monitor this is doing, as we've done, a eating pattern diary and analysis, and alcohol and tobacco risks. Hypertension, underlying causes, not fully understood, but definitely has an impact on cardiac health. It's cardiac output, peripheral resistance, nervous system effects, and hormones and kidneys. Reducing risks, are the risks involved in hypertension, aging, genetics, obesity, salt, sodium, in particular, sensitivity, alcohol. And some of the interventions would be weight control, a eating pattern that reduces sodium, for example, the DASH diet, physical activity, and medications. And here's some of the detail around lifestyle modifications to reduce blood pressure. Diabetes, incident has risen dramatically in recent decades. Prediabetes is also very common. That's elevated blood glucose. It's up there in the top 10 causes of death, seventh among leading causes of death, contributes to several other major diseases, cardiovascular disease. And this is some graphics in the book showing distribution in the US and the progression of the incidence and the prevalence, rather, of diabetes in adults. You can see that in 2004, by the light colors, a lower incidence, and increasing with the deeper red colors, just permeating throughout the US, as we see there. So the prevalence highlights the prevalence of type 1, type 2 diabetes. Type 1, 5 to 10%, and the remainder type 2. And the onset of these is different. Type 1, it could be seen at birth, but certainly less than 30 years old. And most of the cases of type 2 diabetes considered more of a lifestyle chronic disease that's above the age of 40, and the associated conditions with type 1 and type 2. Type 1 being an autoimmune disease, viral infection, inherited factors. Type 2 associated with obesity, aging, inactivity, inherited factors as well. And we can see the causes of each of the understood causes of these shown here. A matter of production of insulin or the insensitivity of tissues to insulin in maintaining blood glucose in normal ranges. The complications of diabetes, initially an acute, is hypoglycemia, which contributes to inflammation and is serious on its own. But then the chronic diabetes or chronic high blood pressure, chronic glucose levels contributes to more inflammation and diseases of blood vessels, large and small, diseases to nerve, and other complications. And untreated diabetes could lead to various other things. You could look at type 1, where no glucose enters the cell. So one would remain in need of glucose, or need of substrate for energy, and one would begin to break down, use up fat and protein for energy. This leads to a rise of ketone bodies. It could lead to acid increasing of acid bodies, and ketoacidosis, and on, could lead to death. it also would lead to increased hunger and increased ingestion of food, which could lead to increase in weight and complications of obesity. In type 2 untreated, we have similar hunger, excessive eating, weight gain, and a number of the other complications that we'd see in type 1 as well. So recommendations for type 1 are monitoring and getting nutrition therapy, and of course having being treated, that is being titrated with insulin and being under the care of a physician. Type 2, similar recommendations, but in either cases, physical activity plays a strong role in keeping one healthy. Cancer, we know cancer is initiated by a number of causes, but what it is for some reason is an initiation of a cell, an abnormal functioning cell, replicating faster than normal, and leading to propagation to large malignancies and tumors and complications from that. There's some known environmental factors that initiate cancer, among them overexposure to harmful UV rays, pollutants in water, smoking, and other environmental hazards, obesity, inactivity, and hormone imbalances. And some of the specific sites of cancer shown here, you could see some of the risk factors. Mentioned in all the risk factors here, we see weight control. So lifestyle changes that we can reduce the risks of cancers are a diet rich in fruits and vegetables and containing nutrients and phytochemicals with antioxidant activity. So phytochemicals, just a large grouping of various compounds or chemicals in vegetables in particular, and of different colors. These phytochemicals usually are an array of colors, as there's groupings of anthocyanins and quercetins and a variety of different compounds shown to have antioxidant activity. They may prevent and reduce oxidative reactions that damage DNA. They also enhance the immune function. That's a protective. So these are complex reactions and seen in various studies, whether they're in vitro, out of the body, or in smaller animals, and more complicated to monitor in humans, but they're all these activities are seen to be attributed to just an array of these phytochemicals. There's some thought that it is a synergy among these compounds that's it's just wise to take in continually different colored vegetables. That's why we say a colorful plate of fruits and vegetables are very healthy. This diet pattern is also rich in fiber, which is also protective against cancer. And physical activity maintains a healthy um, body weight, and reduce the risks of some cancers. So recommendations to avoid or decrease risks of chronic diseases also would include among them weight control, healthy eating plate based on links between that we've links between diet or eating and lifestyle and health. Certainly, individual recommendations are a good way to also avoid certain chronic diseases if you know and understand a family history of any chronic diseases. The updated My Plate, put together at Harvard Medical School, includes this is called the Healthy Eating Plate, and this was compiled and published in 2015. It includes much more detail and includes water, hydration, and activity, and a little more detail around what are in those quadrants shown on My Plate.